Philippa Whitefoot.
Thank you very much, Mr. Evans, and it's an honour to take part in such an important debate. There's no question that England requires more nurses. The ratio of nursing to patient is 5.8 nurses per 1,000 patients, the lowest in the UK. And yet, within NHS England, they can't fill those. They are bringing nurses in from overseas, they're using agency nurses. So that number needs to be expanded. And the approach taken is the idea of simply removing the cap. Now, the challenge with simply removing the cap is how will enough placements be found? As the Honourable Member for Haywood and Middleton mentioned, how will that be funded when Health Education England is actually facing a massive cut? But it's not just the funding of these placements. They require the contribution of nurses and other staff on the wards who are already really busy. So it's not something that you can just dream up in an office in Westminster and it'll all just happen by magic. The issue is also at the end of their training, of this unlimited number of nurses, will they all find jobs in our NHS? It's likely that they won't. Well, we will have wasted not just their money in tuition fees and the costs of being trained, but we will have wasted government money invested in their training. And that is very short-sighted. Because one of the key things is that any government will lose control of workforce planning. Now, with only 5.8 nurses per 1,000 patients, clearly that hasn't worked too well up till now. That is absolutely an argument for re-expanding nurse places. They were at their height in 2004, when we had nearly 25,000 places. And they reached a low in 2012-2013, when it went down to 17,500 places. Now, at the moment, they've just crept above 20,000. But that's not even back to 2001 to 2002 figures. So clearly we need more places. But the idea that the nursing students should simply take on that burden, I find really ridiculous. Now, most of the people within the chamber, other honourable members, will know of my interest. I've been a doctor for 33.5 years, and I am someone who, if we had not had free tuition and grants, actually, back in 1977, I would have not had any possibility of becoming a doctor, let alone going on to study surgery and work as a breast surgeon for all of those years. And I do feel already that England is losing out on students who have talent and do not have the opportunity to follow any degree, particularly a medical degree. And here we're now talking about nurses and allied health professionals. And it's important, as has been listed by some members, who all are included in that allied health professionals. They're a very important group. Now, some members have asked about an impact assessment, and we've not heard any impact assessment. But what is pretty clear is there's been absolutely no consultation. The Royal College of Nursing report that there was no consultation with them. I would have thought that's where you would start. We need to look at what the bursary is. It's not exactly generous, as was explained by the Honourable Member for Lewis. You're talking £1,000 guaranteed. Above that, it's means tested, and that will only reach the dizzy heights of £3,191 if you're in London. That's not a lot of money. As my honourable friend behind me mentioned, the bursary in Scotland is £6,578, all non-means tested, all not repayable, because we consider it's absolutely crucial to invest in the people we need to run our health service. But the biggest kick for these students will be having to pay tuition fees, currently at £9,000 a year. We don't know what they're going to reach in the future. So that's instant debt of 27 grand. And I think that is certainly something that would put people off. I know that even if I'd been told at the age of 18 that I didn't have to pay back till afterwards, the idea that an 18-year-old with no support in the world, as I had at that time, would sign on the dotted line to take on what is almost a small mortgage, is just not going to do it. So the idea that this will not put people off, I think, is naive. It will put off the 50% of nursing students who are postgraduates and mature students. It will put off people from poor socioeconomic backgrounds. It will reduce our diversity. And I think, as we have talked about in this House, the need for this place to reflect our population, it's absolutely crucial that nurses and doctors reflect the population that they serve. And I think that will change, because becoming a nurse will be an expensive business. I think we need to think about why we moved from the old days of the enrolled nurse and the registered nurse, which is what I had. And I have to say, with the number of stripes on their hat, you knew exactly what experience they had and exactly what they could do. And a lot of us thought, why are we suddenly doing degrees? But when we look at where our NHS is now, we see the whole point for that. Because nurses are now leaders within the NHS. And the vision of the future workforce in the NHS is of them leading independently, leading teams, being out in primary care, triaging patients, diagnosing, treating on their own. The idea of the nurse as handmaiden is thankfully long laid to rest. And the same applies to allied health professionals. 30% of the patients that come to primary care have a musculoskeletal problem. Part of the vision of improving the primary care team is to actually allow patients to access a physiotherapist if they have a sore back, a sore hip, or a sore knee. Someone who actually is an expert on what their problem is. We have podiatrists who provide care to our increasing number of diabetics. One of the things that people are probably not so aware of is that the life expectancy for someone with a severe diabetic ulcer is third only to lung cancer and pancreatic cancer. So this is something that really is a threat to patients. So we need podiatrists to actually be checking feet, treating ulcers at an earlier point. England only has 3,000 for the whole of England, and yet the student numbers have been reduced from 361 to 326. We are simply reducing exactly the people we envisage needing in the future. It's like the right hand and the left hand simply not knowing what the other's doing or not talking to each other. As we say in Scotland, two grey cells and they're in a huff. They're just not talking to each other. And I think that needs to change. We need to look at the NHS as a whole, need to look at the people that we expect to provide the care in the future. Now, obviously, in Scotland, as I mentioned, we have a reasonable bursary, and I won't exactly say that our students are living the high life on £6,500 a year. But like our other students, they do not pay tuition fees. The Honourable Member for Lewis quoted the figure of graduates earning £100,000 more. It has to be remembered that's over an entire working lifetime, which is £2,500 a year. That's not huge. That is reduced by whatever debt they have. So if you have students who are coming out with £50,000 or £60,000 of debt for their student costs, their living costs, etc., then actually the extra that they are earning shrinks away almost to nothing. And we will gradually reach a point where people who might have considered being nursery nurses or primary school teachers or contributing to society in some other way that is not well remunerated will simply not feel that they can take that on. We need to look at what we need in the future. We require physios, we require radiographers. These are the very people who will produce the wraparound care for our ageing population, out in the community, leading their team and working on their own. I call on the Minister to follow the Scottish example and invest in people. That's the key, is investing in people. What we have seen, sadly, certainly in my time, the short time I've been in this House, is the debt that was created by the bankers became sovereign debt back towards the end of the first decade of this century. That is now being moved to become individual debt. We hear all the time in the main chamber how we cannot leave debt to future generations. We're talking about public debt. What we're actually doing is we're putting it on future generations. We're putting it on them as individuals. And I think that that's something we need to recognise. They struggle to get a house, they struggle to get education, they struggle to get a job. And we need to change that. And in this instance, the return to us is a coherent, diverse, broad NHS staff made up of people who are committed to what they do. So I call on the Minister, obviously, to answer the many challenges that have been raised today, but to talk about how he will invest in the future workforce that will look after the people of England.